SuperFlex. SuperFlex is just a fun way for me to talk about ligament laxity and joint hypermobility. People with hypermobility tend to have a lot of problems with tendonitises, SI back straining. They have a hard time really developing good muscle tone from exercise. They get excessive soreness because the foundation is unstable. With joint hypermobility, you will feel tight because your muscles are working extra hard to try to stabilize your joints the way they're not meant to. There's a lot of fatigue, you get a lot of soreness, and it gives you the feeling of being tight. But your main issue is that your joints are really fully mobile. They just don't have good structure and control. While there are some genetic conditions that can cause this, the most common problem is you're simply not getting enough protein, and you might have some amino acid deficiencies. Amino acids make up the proteins that do some really important jobs in our body. Proline, leucine, methionine, they tend to be the amino acids that you're not getting enough of. If you're in your 40s or older, you need to start taking in much more protein than you did when you were younger. And that's really important because that's when people tend to eat less. So using a supplement like a collagen supplement, if you're vegan, you could do a plant protein like a mushroom or pea. That's important, along with an amino acid formula. You also want to make sure that you're getting a good multivitamin that has the necessary building blocks for developing healthy ligaments and connective tissue like copper and zinc. This metabolic need is essential to help you build a better foundation. The second tip that I have is that you can't approach exercise the way everybody else does, unfortunately. So using an approach like making sure you're adding a lot of stability assistance, or what I use with my patients now is functional range conditioning that actually deliberately activates the joint capsules first in their end range. So you develop strength and neurological control, which helps to build better composition of those joint capsules. And that supports better tissue composition because of that deliberate activation. So this methodology is actually unique to anything else in training and rehab. It utilizes that joint flexibility and strength. You activate the joint capsules at their full end ranges of the joint motion. So this places you in your weakest positioning. So by activating and strengthening there, you're closing that gap of weakness, and it's more isometric in contraction. So you're limiting that risk of developing tendonitis, and you're really not going to experience that excessive soreness, but you're going to begin building stabilization from the inside out, strength and control, and then everything else will get easier.